Last week, we brought you the story of the Myers family looking for help having another child through a gestational carrier after a cancer diagnosis. Tonight, Andy Satowski shows us what a gestational carrier is and options for family going through cancer treatments.
Family planning can be the last thing on a patient's mind when going through cancer. Dr. Valerie Chevelle with the Fertility Center in Grand Rapids says it's something families need to think about before they start treatment.
It's a lot for them to face the cancer diagnosis, but it's also important not to forget about future fertility.
The Fertility Center works closely with local oncologists to make sure patients know cancer isn't the be-all, end-all in growing a family.
There is the option for women to go through egg freezing, for example, so that eggs are frozen for the future if that woman would need to use them. There's the option to freeze embryos if that woman is in a relationship and would like to fertilize the eggs and keep those embryos for the future if needed.
These kinds of procedures can be expensive, but Dr. Chevelle says there are a number of grants and organizations out there that can greatly reduce the cost.
For example, Livestrong, that can assist with covering medication for women because she will need to be on fertility injections that otherwise could get very expensive.
In the Myers case, Tammy's cancer diagnosis 5 years ago was highly hormone positive, meaning she needed a partial hysterectomy to prevent the cancer from returning. That's why they're looking for a gestational carrier to help them have another child of their own. So what exactly does that mean?
A gestational carrier is a woman who is carrying a child that is not genetically related to her for another couple or individual. And that's different than a surrogate, in which the woman who's carrying the pregnancy is also donating her egg or eggs.
Dr. Chevelle says it's not something they see too often in their clinic, but they do everything they can to connect people willing to help.
It's often a close family member or a friend, although we've had instances where women have connected through fertility support groups or community organizations, or even social media.
Being a gestational carrier is a big commitment, and there are some legalities women need to be aware of.
In the state of Michigan, only non-compensated, altruistic gestational surrogacy is permitted. The woman who gives birth to the child is considered the legal mother, and so oftentimes there can be a pre-birth order put into place, so all parties involved need to have legal representation.
There's also health requirements to keep in mind.
We also want her to have psychological counseling with our fertility counselor, because this is a huge commitment for a woman to take on.
And if this is a process a family is considering, Dr. Chevelle says the center does go above and beyond to get the process started quickly.
The process, because we know it's a very time-sensitive window that we have to work with before treatment needs to get started.
Well, that was our Andy Satowski reporting. If you're interested in learning more about options for patients going through cancer or becoming a gestational carrier, the number for the Fertility Center is right there on your screen.